So welcome everybody and thank you for joining. It's going to be another exciting workshop for everybody here. We've done a lot of preparation and I think we put together a very good event for today. So my name is Mike Penkunas. I'm a research fellow at the United Nations University International Institute for Global Health, which is also known as UNU-IIGH, and we're located in Kuala Lumpur, Malaysia. So I'm a research lead and I manage our program around strengthening capacity for local decision making. So for those of you who may not be aware, the UNU is a network of 14 United Nations think tanks, and UNU-IIGH is the designated UN think tank specifically focusing on global health. So the Institute serves as an academically independent research and policy translation hub, and we work with our UN member states as well as other UN agencies and UN programs. So you've joined us today in what is the second workshop and what we plan to be a series of 3 workshops. And for this series, we're focusing specifically on early career professionals. So this is the time where we all seek out additional support, look for advice, and try to take advantage of skill building opportunities. This particular series is focused on bridging that gap between evidence, which is what we produce through research, and policy, which is the space where decisions are made. So this gap is historically very large and quite persistent, but there have been great strides made in the last decades to close this gap, and we're going to be exploring a couple methods to do just this. So last month in October, we had our first workshop where we focused on stakeholders. We were considering who we want to engage, why we want to engage them, and the methods for engagement. And we talked about different stakeholder groups. Today, we're going to build on these conversations around stakeholder engagement and talk about communication itself. So for today, we're going to be drilling down on the power of narratives, or what we're calling it today, the storytelling for policy audiences. We've lined up 2 experts who have spent many decades thinking, writing, and teaching about communication for the workshop. So we trust we're going to learn a lot from these talks, and as I mentioned, we have some exciting activities that the team has prepared. Before we dive into the substance of our program, I have a few housekeeping notes. First, please update your display name to include your organizational affiliation. You can do this by selecting the menu button, which is the blue box with the 3 dots. It's in the top right-hand corner of your video if you're in gallery view. Just click on that and scroll down to rename. You'll see that my IIGH colleagues have done so already. Secondly, please keep yourself on mute if you're not speaking. This helps cut down on background noise, but we ask that you do keep your video on if your bandwidth permits. This helps break down some of the formalities and we can interact with each other a little bit easier. We are also using the chat box, which you can locate there on the lower toolbar. This is where you can ask for assistance with the technology if needed. You can contact my colleague Radhika there. You can have side conversations. This is a great place to ask questions and have side conversations that aren't exactly pertinent to the discussion at hand. Please do keep in mind though that chat feed is visible to all participants. We are saving the chat feed, but it's not going to be shared. Next, we're going to be using the breakout room function through Zoom. There's no need for you to do anything in particular here, just to let you know. You're going to be automatically prompted to join your breakout room, and then just be aware that when it's finished, you will be automatically transferred out into the plenary meeting space. This workshop series is a collaboration between UNU and the Lancaster University in England. With that, I want to pass over to Emmanuel for his introduction from our colleagues from Lancaster U. Emmanuel, please, over to you.
Great. Thank you very much, Mike. Good morning, good afternoon, good evening, no matter where you're joining from across the world. I also would like to extend a very warm welcome to everyone on what is going to be a really, really exciting session. I'm really looking forward to it. My name is Emmanuel, and I work with colleagues to show that there's always an alternative way of doing things so that we can change our world. I'm currently doing that through Lancaster University. and Imagination Lancaster, which is a design-led research center. I'm pleased to be joined today by two colleagues of mine, Luis Mula and Maria Fonseca Braga. But also, I'm the convener of the Design Research Society Special Interest Group for Global Health. And we have a representation from across the world, again, looking at global health, obviously. The topic of today is very important, not only for career, because of course, storytelling is the natural language, if you like, a natural form for persuasion. But it's also for our own lives, because the way we connect with people is through stories. And I strongly believe that if we were taught at school history through stories, we wouldn't be repeating history and the mistakes of it. So welcome again, and I look forward to meeting several of you in the breakout sessions today.
Thanks, Emmanuel. Appreciate the welcome and appreciate the continued collaboration between your group and IIGH. So with that, I want to dive into the substance of our program. I want to introduce our first of two speakers today, and this is Premesh Chandran. Prem is the co-founder and CEO of Malaysiakini.com. It was launched in 1999, and Malaysiakini is Malaysia's top independent news website. It reaches over 8 million readers in English, Malay, Chinese, and Tamil. Prem holds a degree in physics and a master's degree in international studies. He's a TED Senior Fellow, a recipient of Asia Foundation's Chang Lin Tan Fellowship, and the Media Personality of the Year in 2012. He's also a business coach and has coached over 40 companies in the last 5 years. His other interests are in transit tech and affordable housing. He believes in finding practical ways to achieve ideals. Prem, please, over to you.
Thanks, Mike, and very good afternoon or good evening or good morning to all the participants coming all over the world. Thanks for having me today. I think it's a really interesting topic about how we look at research and present that research in terms of a narrative, a storytelling, to our peers, to policymakers, or even the public. I think the key thing is that there's a lot of research going on, and and how to prevent it from getting stuck just on a bookshelf or just in a filing cabinet. How do we actually bring it to the attention of the public? And there's definitely an overflow of information, and people have less time to consume it. Malaysiakini has been running for 21 years, and we're in the news business, but we too have to compete for attention. How do we make sure that people visit us, read our news, consume our news, share it out, and therefore getting influence in the public sphere. So for news agendas, of course, it's one kind of question, whether it's interesting, whether it's fast, whether it's engaging. So news has got news values. So similarly with policy, the question is, what values do you need to bring to the table in order to make this research influential? So the question is, in many ways, we have to even design our research or design our work around creating influence. It's not just a research done in abstraction. It is a research done with target groups in mind. How would our peers think about this? How would policymakers think about this? How would the public think about this? So presenting the research and understanding the research and its relevance cannot be an afterthought. I think that's the first rule. It has to come very, very early in terms of conceptualizing that, and then how is it going to be presented. In the world today, a lot more is being presented through video, through infographics, and I'll give you some examples rather than just a straightforward text format. So I think this is really interesting about thinking and doing a bit of design thinking from very early stage about how do we present this research. And obviously, we need to crystallize what we mean by relevance. So for your peers, obviously, it is a relevance to perhaps their own research or a topic of research of their interest. For policymakers, most often it's kind of a cost-benefit analysis, some sort of policy analysis, financial costs, health costs, benefits. And so how can that be presented to policymakers in a very quick, easy format rather than a verbatim text? And for the public, it's really kind of like, what's in it for me? Is this going to change my life? How is this going to happen? My background is physics, so I still read a lot of physics research, and obviously there's a lot of physics studies in quantum mechanics and things like that. But what really gets consumed in terms of physics in the public is that, oh, this discovery is going to, time travel is now possible, or there may be a black hole in our solar system, or 100 planets found nearby, or there will be 208 alien civilizations in our galaxy. So it is very kind of high level quantum mechanics and studies, but it's presented in very layman's terms for the public, which makes them engage and understand the nuances of what's being presented in a popular fashion. Some of you who watch Netflix, they recently launched this series called Queen's Gambit, and there it's about chess, but chess is presented in such an intriguing fashion that even non-chess players find the series very interesting. So it's really about designing your influence from scratch, from the beginning. I don't have much time, so I'm just going to show you a couple of projects that we have done at Malaysiakini, and then we can take more questions later. I'm going to present my screen. I hope I get this right. Are we all looking at something on COVID? Yes. Yes. Okay. So this is our work on COVID-19 in Malaysia. It's kind of a tracker, and we update this every 24 hours when the results come out. First of all, you notice that we publish it in many languages. We have got English, Malay, Chinese, but we also have it in 3 languages of migrant workers, Nepali, Bangladeshi, and Burmese, because we have a huge population of migrant workers in Malaysia, and very often they are in confined areas and they are actually subject to COVID transmission. So we actually presented the data in 3 languages of migrant workers. And we've got a lot of daily cases. We have maps where you can zoom down. We have by state, by district, and these are some of very, very popular pages because they actually want to understand what's happening to them in their particular area. We've got FAQs, so we digest a lot of information on a very steady basis, and every day at 6 p.m. we update the information, we send it out, and people are able to follow it in great detail to understand the consequences of COVID in their daily lives. Obviously, this is a news organization which is coming out every day, and we have to do this, and policy work is different. But the idea is to actually present it, to understand the information being presented and to put it into charts, into graphs, so they can actually absorb it. This is one example, and let me try to do another example if I can get the right tab. Okay, can you see this tab on water? Yes, are you seeing the right tab? Right. So this is another example I wanted to present, which is nicely done work. Our sewage company wanted people to better understand issues around sewage in the country, in hope of eventually people really realizing what goes into managing sewage and whether they could actually increase the price of sewage management. So the question is, how much water do Malaysians use compared to the rest of the world? So this is done in a quiz way, where we get people to read and engage. So let's start with the basic water knowledge. And it's a quiz about, how much water we use compared to the rest of the world, comparing Malaysian households' water usage in other countries. So you get to understand what the guess is and what Malaysians' consumption is compared to the rest of the countries. And then you scroll down. Bingo, your guess is very close to the answer. It's 62%, and then you get people to share the results. And it shows Malaysia's water consumption against other countries in 2017, and we're educating people about water. Then we talk about water use within Malaysia. What are the average numbers in the real picture? Let's take a look at water consumption at the household level. So we look at different states. So I live in Selangor, so I will click Selangor, and it shows that what is my water consumption in Selangor compared to the rest of the country. How does it work? you know, and a little bit about water supply, and then we talk about wastewater disposal, you know, about, you know, water being managed, what happened with that waste, and then we talk about the sewage company called Indah Water Consortium. We show pictures about it, what exactly happens. Mm, you know, all the networks, how much does it cost us, and we start going into that. Every house has a system, how much do we pay, and again you're asked to guess for it, and then say we only pay 34 cents, you know, compared to other countries. You know, this is actually 556, and again they give you comparable analysis. So it's a very interactive way to present the idea. And, you know, how do we manage government subsidies, how much does the government subsidize it. So it's always asking you to take part, to guess, and you can see it's also done in a very vertical format, which is friendly towards mobile phones, because 90% of users are going to, you know, watch this on a mobile phone, not on a desktop. So it gives you ideas about government subsidies, different percentages, etc. And you know, what's going to happen in the future, how much will government have to subsidize. So it takes about 10 minutes to go through, but it's very data driven and very scientific, and, you know, and in the end asking for the help. Will you help? And how do you create a sustainable picture, yes or no? And it gets you to say, okay, yes, you know, we're interested in this, we want to know more, we care about our sewage system, things like that. So you can see there's a lot of complex information presented in a very you know, data format and interactive format, which gets a lot of people to engage. And there are many data visualization tools. You might have heard of a Mapbox, and this is a visualization about done by Mapbox about US unemployment rate, how it's changed over time, giving statistics analysis. So there are a lot of these sort of tools out there. You know, so we can use these sort of tools. So these are my examples I give. I'm gonna stop my sharing. Yep. Okay. So I'm back. So really, the you know, what do you do? First of all, is to understand your audience, who you're presenting this work for. And build a relationship with your audience, whether it's the public, whether it's peers, whether it's the media. If it's the media, you need to build a journalist with an editor, with a journalist or an editor who's interested in the topic. Don't just send out a press release. And if some materials are meant for academics, don't send the same materials to editors and journalists. They just won't get it. So you really have to be very purposeful about your communications. So if you're working with policymakers, it's really critical to understand what the context the policy making is coming from, not just do a PowerPoint and kind of present your results, but to say, look, this is how you can experience it. Policymakers are also very concerned about getting the public on board. So here's how, you know, what does research say? What should policymakers do about it? And again, how would policymakers communicate that information to the public and other stakeholders? So policymakers will be concerned about how can they convince the, you know, the prime minister or a minister. How would they convince the public? So to actually give them an idea about how this information can be conveyed to the public itself using these sort of tools, you will get a very good buy-in to your research. Not only the fact that it's well researched, you actually know how to present the results, and you'll see a lot of buy-in from the public also for your research results, and that will make you a huge influencer in the public, which will then make you be come in front of media, etc. And this is how it will allow your research influence to grow. So I know I don't have much time, so I did a quick presentation, but I'm happy to take more questions and elaborate on some of the things I've presented. Thank you.
Prem, thanks so much for that. Appreciate that background. You've really started to whet our appetite around this, you know, idea of presenting data, telling stories for non-academic audiences, communicating with the public and other stakeholders. Thanks a ton for that. I do want to preserve some time for our breakout rooms, but let's please take one question from our audience. If we could see, let's see, hands raised. Is that possible? or a reaction from our audience? One question. I'm not sure how we're gonna, I guess, send me a chat. No?
I can share the links on of the pages I presented.
Yes,
So,
please.
you know, you can,
Okay, we have a, here we go. Our hand is raised. One from Pascal. Please, Pascal.
So,
There we go.
hi, Prem. Thank you very much for that. I know the visualization is really rich and it's really engaging. But for most of us, we need the level of technical skill to actually be able to do that. Are there, can you do it and do it bad? Is it better to do it and do it badly if you're not you don't have all the resources, or stick to what you know? Can there be bad visualizations?
yeah, definitely there can be bad visualizations which are very confusing and erodes the the value of your research. So I think the question is definitely to find tools that you're comfortable with to do it with, or find a partner to do it with, But just imagine if you're spending a year of your time for research, you don't want to spend 1 week or 1 day figuring out how to present it. So again, it's about thinking about how to present it from day one, and devoting enough resources so that it is presented well. So it's really a good investment. I mean, it's kind of the analogy is that, if you want to rent out a house, but if you keep it bare, your house can be $1 million, but you're not going to get value. But if you dress up the house, and you invest that extra time to dress up the house, that house is going to sell for so much more. So it's kind of like dressing up your research. So it's if you can't do it yourself, it is really you should not actually go into it and present bad visualizations, because that really downgrades your information. It's to figure out tools and quizzes and other ways of doing it within our capacities, I think. And there are actually a lot of tools. Google Data Studio, there's Kahoots using quizzes. There's a lot of do-it-yourself tools that you can use to build these tools very quickly. Yeah, PictoChart is one of them. Great platforms out there to build good visualizations. But always remember that most people watch on mobile phones, so try to make it mobile friendly.
Super, thanks, Prem. And I see we have a few pieces of software, mobile sites being dropped into the chat, so please check those out. Thanks, Pascal, for the question. We're now going to move on to our breakout rooms. Once again, Prem, thank you very much for that lightning talk. We call it a lightning talk so it can be fast and impactful. I think you achieved that. And I also know there are some real lightning storms happening in and around KL. So please stay safe. And if we lose the feed, please stay online so we can get back to the group. With that, we're going to go into our first breakout session. Each group will have their own facilitator, and your facilitator will orient you to the activity and walk you through what we're going to be doing for the next half hour or so. So please, everybody, enjoy the first breakout, and we'll see you again in plenary. Is everybody back?
Yes. We need more time.
Yeah, I know. We always need more time. I'm sorry. Okay. Thank you, everybody. We are now winding up on the first breakout room. So what we're going to do now is move on to our break, and then after the break, we'll reconvene for another presentation, and then head back into our breakout rooms for a second exercise. So please, everybody, let's take a 5-minute break now. I believe we can come back at 3 minutes past the hour for our friends in Malaysia in our time zone. That'll be 5:03. Please, we'll play a quick video on doing some stretches at your desk, and when this is over, we'll reconvene. Thank you. everyone. Welcome back. Please turn on your video if you're with us. Great, thanks. I see a couple people are rejoining. I hope everybody is feeling limber and enjoyed that video. Super. So what we're going to do now is move into the second half of our workshop. We're going to hear from another speaker, again, with decades of experience. This is Professor Do Mayer from the University of Southern California. Due to the time difference, she's unable to join us live, but we're happy to say she did record her lightning talk, and we'll be able to play her video in just a minute. So before we go into the lightning talk video, let me read her introduction briefly. Do Mayer holds the Mary Pickford Chair at USC's School of Cinematic Arts, where she teaches documentary and fiction film making. She holds a joint appointment in the Annenberg School for Communication and Journalism, where her work is centered on the practical application of communication campaign strategies and designs for social issues and health-defined organizations. Professor Mayer has been working in film and television for over 25 years and has produced, directed, and provided technical support to hundreds of productions in the US and in numerous low and middle income countries. Much of her programming has been in the area of family planning, basic education, health, nutrition promotion, HIV/AIDS prevention, population, and women's issues. She has designed and implemented numerous workshops for NGOs on how to effectively get messages out to their target audiences using media and face-to-face communication. She also received the Associate's Award for Excellence in Teaching, which is USC's top teaching award in 2009 and 2010. So please, with that, we'll listen to Do Mayer's recorded lightning talk now. Please, Harvey.
Hi, I'm delighted to be here and to be able to speak to you, even though I'm quite far away. And I want to talk about why stories are so important. Why isn't good data enough to change minds and attitudes in policymakers and in the rest of us? What is it about stories that's so human and critical? And I'm not there with you to ask you to answer, but think about some of the answers as I come up with them. Stories are emotionally compelling. Somehow they make us feel, they touch us in our heart. They're memorable, they stay with us. They can inspire us in new ways to think differently and do different things. And they often give us new ideas about something that we hadn't thought about that way before. Basically, we humans like stories, and they're a tremendously important way for us to communicate. But in the last 20 or 30 years, we've had neuroscience to back up our understanding of stories with excellent data about different parts of how the brain lights up when we hear and see stories that help us improve our comprehension of situations. Neuroscience has really given us a much more scientific argument that when material is in a story, it stays with us in a very different way. But nevertheless, we somehow assume that some audiences, especially very smart, highly educated people, don't trust stories. They're too sort of soft and gushy. And that we really need hard data to be persuaded. That policymakers are very rational people and we should just give them the facts and assume that they will know what to do with that. Well, for anyone who was shaking their head while I said that, I have news. Almost all of us are more persuaded by powerful stories which may have some data in them, but they're narrative based. They can have a little data in them, but if the material is loaded with data, it's very hard for us to remember it. It doesn't stick with us. The stories are more meaningful, and there's lots of tests on this now. They make sense of life for us. They're stickier. I like sticky, that idea of it. They stick with you. throughout your life. So what is a story? Well, there are many different ways and definitions to consider when we think about story. But for the purpose of simplicity, let me give you a definition that I think works pretty well. Again, I'm not arguing this is the only definition, but I think this will help us in thinking about this in the context of this presentation. So my definition is somebody wants something very much and they have trouble getting it. They have lots of trouble getting it. They have obstacles. They have issues. There are external reasons that there are problems. There are internal reasons why there are problems. So you really do have to think about how to develop stories that use that component of wanting something and having difficulty getting it as a way to think of stories that cause an audience to lean in, as we say, to get really interested. Many organizations think they use stories pretty well, and they're often just trying to disguise their data with some storytelling elements, and that doesn't work particularly well. Organizations may need to spend more time on their characters' problems, their obstacles, their troubles, and less time on the success of their programs. So a common website story in many organizations often looks like this. Number one, people were in pain. Number two, we have developed a very excellent program to solve the problem. Number three, give us money. That's not a story. We like to think that everything's a story, but everything isn't a story. That's not a story. That's sort of a mixed statement of a situation and why we, the organization, are terrific, but it's not a great example of powerful storytelling that will really get people to think differently or feel differently or be part of a situation that feels more meaningful to them. So let me give you a good example, or one that I think is good, from the Global Fund to Fight AIDS, Tuberculosis, and Malaria, which began in 2002, and which I'm sure many of you are familiar with. The Global Fund was funded by many different donor countries who supported its ideas, and it started with substantial funds, and it did very, very well in its work. But by 2008, the Global Fund had a problem. Several donor countries had cut their pledges, and some were just not paying up. Donor fatigue seemed to have set in, and policymakers felt that the fund was just a bottomless pit of needs that would never be met. Up until then, the messages from the fund to the donors and the policymakers were primarily framed, as I was mentioning earlier, in data. And the organization had excellent numbers in terms of what they were doing that they could use. But since that didn't seem to be working, the fund communicators decided to try a new approach. And they developed a campaign called Here I Am, which you can find on your internet access as well, which provides video portraits of real people talking about very specific problems and health issues and how the Global Fund has helped them personally. Characters from all over the world talked about how the fund had made them access testing around HIV/AIDS and gave them specific support for their very serious health problems. So there are very personal stories based in the idea of people who wanted to get healthy again and couldn't do it without the support of this very important program. The Here I Am program was shown online, it was shown at many meetings and discussions, and it was shown to the board of directors of the fund. And it was extremely successful. That year, the replenishment fund request had a 30% increase in funds, and countries pledged $12 billion to deal with the work of the fund. That's a pretty good success rate, 30% increase in 1 year to the funds that were being used. Why? Why do stories work? Why did this story work? Well, there are many reasons, I'm sure. It's always hard to tease out the results when situations are complex and hard to read. But certainly the more powerful that storytelling was, the more useful it was in the context of this. It was an important piece of the puzzle, and one that got significant credit for the increased donation by policymakers, which is, of course, what we're all looking for when we're trying to get more effective results for our efforts. In your next breakout session, you're going to be asked to take on these ideas of effective storytelling for change. I'm so sorry I can't be with you to hear what you come up with. Let me leave you with a helpful thought for your work. It's a little catchy phrase that I think you might consider useful. Numbers numb, stories store. Again, numbers numb, stories store. Remember that and keep up with the exciting, important work that you're doing, and good luck. Thank you.
Well, there we go. Our recorded lightning talk from Doe. I think we got a lot of good information from there. We have to think about our stories, and the thing that really resonated with me in Doe's talk there is it's about somebody who wants something, but they're having an issue or having a problem. And we have to construct our story around how they are trying to overcome this story. So what we're going to do next is move back into our breakout rooms. We do have more time, which is great. So I know some people had a little bit of a hiccup around the lightning storm rolling through KL. But don't worry, we have our second breakout. We're going to go back into our same rooms with our same facilitators, pick up on our story creation there, and then we'll see everybody back in the plenary in about 30 minutes, and we'll be able to share what we've come up with in this second breakout room. So now, Radhika, please help us get into our breakout rooms. Coming back into the room. Hope everybody had fun with that one. I think we were. A good way to reflect on how we communicate our results. I think Doe's story was particularly inspiring, thinking about how those stories store, right? And how it's beneficial to get these emotional connections. So what we're going to do now is do a round of sharing. I believe we'll go group by group, and that each group has hopefully elected a presenter for the sharing round. Is there a way to project the presentation slides? I guess I can do it, right? Just give me
Okay, Mike, I'll do it. Give me a minute.
Okay, good. Thank you.
And I'm going to work through based on which groups have already put their pictures in. So if you're a group that is still quickly scrambling for your picture, you have a moment to pop it in. Make sure you put the picture onto the slide that has your facilitator's name on it, okay? So the first group up is Emmanuels group. And I will start a 90-second timer. Okay, over to you.
Hi everyone, we are from group 8. So you can see here Nurse Kia, affectionately called Makcik Kia by her patients and co-workers. She is a devoted mom and staff nurse at Sungai Buloh Hospital in Malaysia. She has worked tirelessly since the country's first response to the COVID-19 pandemic 11 months ago, like many other frontliners in the country. She has 2 young kids, 1 and 4 age, whom she hasn't seen for months. She works in a hot and heavy PPE suit for 12 hours continuously every day, and after work without fail, she would call her kids, who are now cared for by their elderly grandparents. They would cry out, "Mom, when can we see you? We really miss you." All the frontliners want is to serve the country without having to worry about their children's welfare. One of the patient's families uploaded her video plea on the YouTube, and many people were moved by the mother's devotion and her hardships. attention to the plight of our frontliners, like Makcik Kia. And together with the Ministry of Women, Family and Community Development, we have agreed to provide childcare service to our frontliners. Hashtag Kita Jaga Kita. Thank you.
That's fantastic. Okay, next group is Lavanya's group.
Hi. Hello?
We can hear you.
Okay. All right. So I'll start. This is like a social media post that is also picked up by media. So the story goes, I'm an emergency department doctor in a busy city center hospitals in Bergamo, Italy. I have 2 kids and my elderly parents who live with me. Today, I treated an elderly patient who was the same age as my elderly mom. She came into the hospital yesterday by her daughter. Her symptoms were already very advanced. I tried to call her primary care doctor, but he was not available. I am working without information and I have to just do my best. I am not sure if she will make the night. Friends in the media, these cases can be prevented. This is what we need. We need a system for the elderly to be tested fast and early by primary care doctors especially. This needs to be regional and locally connected. They need to be equipped with COVID test kits and for this information to be sent to hospital staff effectively and efficiently. Public in general, particularly the caregivers, should be aware of how easily the elderly can be attacked by the virus. And there are a lot of residential aged care facilities that are crowded and are understaffed. So we want to invite media to highlight on this issue, ensuring authorities to provide enough financial assistance to the crowded and understaffed residential aged care facilities, as well as ensuring the public do not take lightly any mild symptoms that the elderly in their care are facing.
Oh, thank you. Louise's group.
Hi, I'm Jane. I'm representing Louise Group. I'm a data scientist, but in this story, I'm working in an old folks home in Kuala Lumpur. During the COVID pandemic, we have faced significant problems accessing clean water for the old people living here. Because of the lockdown restrictions in our country, the old people have visitors from their family members are become lonely and isolated. We all very busy caring for all elderly who are sick or need additional care. So we do not have time to try and resource water or to support for lonely residents. We develop a program where community volunteers help us to get water and food and bring it to the old folks home. The volunteers were screened for COVID, spent time with the elderly people, and we found that the volunteers make the elderly less lonely. So the volunteers were young people related to the old people and from the local NGO group. That's all for me.
Great, thank you very much, Louise's group. I'm just going to very quickly stop the screen share because I want to show it with the timer as well. So there we go. Okay, Mariana's group.
Hi everyone. Today, Mariana's group is going to present about someone called Irfan. So Irfan lives in a retirement house. He's 65 years old and his family lives in another state in Malaysia. He has mobility restrictions and he can't go out to get groceries, to exercise, or to socialize. Irfan has diabetes and is very concerned with the risk related to COVID-19. A friend of his recently passed on by himself and his body was discovered a week later. So Irfan now feels very afraid and lonely. He doesn't want to feel alone and would like to have more support from welfare services regarding getting in touch with others, having someone to check on him. He imagines community volunteers would come by and call him and remind him about the medication that he should take. The older adults living with him also fear the risks as they have lost friends too. They are part of the largest high-risk population. Mental health support and other practicalities such as meals, delivery, entertainment options like renting movies, borrowed books from neighbors or volunteers, and even an internet connection and interactive activities would keep them connected to their loved ones and friends and improve their conditions to face the pandemic in isolation. In addition, early identification and treatment would also help them to face the pandemic better. Thank you.
Next group. Mike's group.
Hi everyone, I'll be talking for Mike's group. So our story is about Siti, and Siti is a 65-year-old widow who lost her husband to COVID-19 4 months ago. She lives with her son in a rural area in Kedah, Malaysia, who also lost his job around the same time. This was a very hard month for Siti, who also has diabetes and hypertension. She usually goes to the private clinic for her treatment, which costs a lot of money there in Kedah. So Siti used to manage a catering service to contribute to her son's bills and her diabetes treatment. But now, because of the COVID, this catering business had to come to a standstill, and all events have been cancelled. So she's been suffering from stigma due to the COVID, and because her husband had also died, and so she's in a rough time. People are even scared to also speak to her since her husband died due to COVID. Siti is feeling depressed, guilty, and is running out of money. Siti heard the PM announcement about the economic stimulus package to be carried out through the e-wallet app. And even though Siti doesn't use e-wallet, her son does. Siti is very thoughtful that her son can access these benefits. Is very hopeful that her son can access these benefits through the e-wallet after a simple verification process. At the same time, Siti's son is able to use the e-wallet funds to pay He's able to use the e-wallet funds, which is going to help Siti to pay for her tele appointments at the private clinic, making sure her care is continuous. This package has relieved Siti's stress short term, but she's still concerned about her family's long-term livelihood during the pandemic. If the fund is not sustained, it is clear that Siti's savings will get drained. That's what we had for our group.
Fantastic. Nadia's group.
Hello, everyone. So I'll be talking for Nadia's group, and it'll be about Nadias, a 25-year-old woman in Kuala Lumpur who lives with her grandmother. At 3 a.m. on Monday morning, Nadias lay in bed, unable to sleep, wrestling with a dilemma she faced on the fate of her grandmother, who suffers from dementia during this pandemic. Caring for her was already a challenge before the pandemic, and now with the current situation, it had gotten worse. The thought had crossed her mind to find her a care home, someone professional to look after her. It wasn't what she wanted, but maybe it was necessary. This might have been a difficult choice before, but with COVID-19 spreading throughout elderly communities and care homes in KL, this choice was even more daunting. It could be a deadly decision. Nadias wished to continue to care for her grandmother, who had raised her as a child, but with the burdens of the lockdown and the MCO, the support from government and the community just wasn't enough. She heard of programs in other countries, care provided at home by visiting nurses, advice from social workers specialized for the care of dementia patients, and she wished she had better access to this within Malaysia, allowing her to ensure her grandmother had proper care, but more importantly, to keep her safe and isolated at home during this difficult time.
Yeah. Hello, this is me Pritika from Asia's group.
From Nadias group or Xiao's group?
Yeah, this is me Pritika from Asia's group.
Okay.
So, yeah, my story is on the migrant woman. So, Rita, the 60-year-old woman, is lying awake and cold in her bedroom. Migrant and widowed, she looks at the ceiling, white and gray. Her future resembles the ceiling, equally white. Recently COVID positive with hypertension, she is one of the 1,000 others in the country who is left alone with COVID-19 is in isolation in her room. I don't have anyone, she cries. Her loneliness is too heart-wrenching. Additionally, being migrant status is not letting her help her access to facility. She needs a wheelchair for mobility. One fine day, I visited her home. I asked Rita how long she has needed a wheelchair and whether it has been hard for her to obtain one from the government health clinic. Her response was, as a migrant, it's difficult for me to obtain basic health service here. I do not have regular income and my husband is too ill to work, which means we do not have money to purchase a wheelchair. A few months ago, I started feeling pain in my heart. I informed her condition to a local health facility. She is referred to a more central hospital there. But to sustain her health in hospital, she needs financial support as well. Local press writes her story. Immense crowdfunding comes to her. Also, local organization working for migration comes to know her situation. Today, she is being treated in hospital with funding from the migrant organization. It shows an example of resilience, immense support from press, and help of everyone. She is an example of hope. Thank you.
Another fantastic story. I am going to go back and see which groups we missed. So, Emma's group, that's my group.
Right, so we didn't really decide on a speaker. So yeah, I can do it. So we are talking, we have someone called Halima. She is 72 years old and a widow. And currently she is living in a remote area all by herself. So just recently she has received news that her best friend died suddenly due to COVID-19, and she is feeling very scared. She's confused by all the information she has been hearing, but she still does not know what she needs to do to protect herself. So Halima needs advice on what to do, and she needs the advice from someone, from a name that she knows and she trusts. So the local government has been putting lots of information on social media, but again, Halima really does not have access to internet and isn't familiar with the social media where most of the information is being shared. So luckily, though, an NGO in that area has been working on providing information through radio programs and TV programs to inform people. And now Halima can listen to 5-minute broadcasts on the radio and gets the information that she needs.
Thank you very much. And we have one last group, which is Nadia's group. I'm just going to refresh the slide. One moment. Why? I think, okay, there we go.
All right, hello, I'm Benhan, I'm from Nadias group. And our focus is on a lady named Devi in India. So she's a rural farmer, she's about 30 to 50, about 30 to 40, and she has a mother. And there's a lot of old people in her society, and she wants to be able to support them, to give them food, because they're just really poor farmers and they need medicine and masks and sanitizers, and those are things that cost money and they have a hard time getting income. The challenges they face would be the digital divide, so they're not really well versed in technology or anything, and they want to go viral. So with the help of some people from the younger generation, they created a video that highlights the difficulties that they face every day, the cleanliness of these waters, the lack of food, and the lack of basic needs. And they hope that this video will be able to help them to get more skilled people, to inform the people, the higher ups, to notice them more and to get more resources. Thanks.
Thank you very much. And now I'm going to go back to Harvey's group. Okay.
Hi, can you hear me? Yes. Just a story of a girl living in Seremban. Every day I told my father not to go out. He always comes out with something every day. Today he needs to buy the battery. Tomorrow he needs to buy detergent. And I was worried about my father living alone in Seremban. How can I help him? MCO and road restriction makes it harder for me to go home and help my father. But few days ago, I was at ease knowing that the community people, together with their district AKM officers, set up task force. These young volunteers are launching small grassroots teams to help the elderly by handling their grocery checklist. I hope this initiative can be adopted by the Women Ministry for the whole country, not only to help the elderly, but to reduce their risk for COVID. That's all.
Thank you very much. Now I think that should be all of the groups. Please, no it isn't. We haven't had Mariana's group.
Oh,
apologies. We did?
We did, yeah, we did.
We did. Chat
Okay.
presented.
Yes, you
Thank
did.
Everyone again.
Okay, I was just checking that I hadn't forgotten anybody because I didn't do them in order. Fantastic. So thank you so much. I'm really impressed by how quickly everybody was able to pull those stories together and kind of the resonance and the stickiness that they had. And so I know we've overrun already by 10 minutes and that people need to leave. But for those of you who are able to stay, we'd just like to take a couple of minutes either for people to share their kind of reflections on the process of creating stories or the way that the stories resonated or did not with them. And if you think that this might be kind of an approach that would be useful in your own work. So please just wave your hands at me if you'd like to speak. Any reflections on creating stories? Please.
I think it's very nice to understand how to put the characters, the challenges, and the resolution that we want. And I think when we tell the stories, the intonation, where we pause, that's also contribute how people take the story, and it can become stickier. You know, if it's a sad story, you use a more slow tone voice, then it makes sense better. It gives more effect, I think.
Great, thank you very much for sharing, Manira. And then the next question, I'm really sorry, I'm not sure how to pronounce your name, but
Farah, is it?
Farah, yeah, thanks.
That's actually abbreviation Farah Nabila. Sorry about that. So I think one of the reflection is to ensure that our story is also concise. It cannot be too complicated, otherwise people would like lost focus, and hence our message is not really delivered. So it has to be really structured and focused, not too complicated. Yeah, so that's one takeaway that I really, want to share.
Great, fantastic, thank you. And Shan Leong.
Yeah, just building on that, I think we have to fight that instinct to be complex, because we have so much information, so much data, and so many goals. But just to be focused on one goal, one heart-wrenching story, or something that will pull at the heartstrings, and go with that.
I agree. I'm going to steal Emmanuel, who's on the call. I'm going to steal his analogy. But when we were talking about this, he talked about a tree, and a tree having very many branches. But when you're telling your story and you're trying to affect a particular change or influence a particular decision, the importance of finding your trunk and sticking kind of to that straight narrative, not getting too lost along the way. So I think that's a really interesting reflection. Any other reflections people would like to share? Yasmin?
I think that the process needs to be participatory, because there will be a lot of stories out there, and there will be, stories from every corner. So to just make the process participatory, to ensure that every voice, or at least the most marginalized voices, get heard. I think that's very, very important. Thank you.
I think that equity point is really important. It's very easy to tell stories of people that we already know or we already feel familiar with. And we have to push ourselves to think about how we tell narratives outside of our comfort zone as a way to introduce all of us to other perspectives and other situations. So I think that's super important. Okay, I don't see any more hands up, and I'm going to kind of. Oh, yeah,
Mary,
please.
Emma, I just had one question. No, I learned a lot, and it was interesting going through all the steps of creating a story. I was just wondering, since we will be sharing this kind of stories with people who are making real decisions and actually to influence their decision making, do these stories have to be real stories, one, or two, do we have to acknowledge somewhere that this is not if in case it's not a real story, that it's a made up case study or something?
So I have, yeah, go.
So I was going to say that I can perhaps answer that. It's better if the stories is real, and the reason for that is if you're telling a real story, then that brings out the emotion. And again, that makes it more convincing to who you want to convince and persuade. If not, then yes, I think at the end you can be transparent and say this is a story influenced or inspired by X.
I think just to add to that, for the purposes of this workshop, we of course created fictionalized characters, but what we're hoping you'll be able to do is to take some of these approaches and start to implement them in your own work based on the research that you've done. And so hopefully you will have real people that you've engaged with or interacted with whose stories that you want to tell. And there'll be steps you might want to take to conceal names or to give fake names if there's issues around particular vulnerabilities, but the essence of your story should be based ideally on a real person. And I think the second point I wanted to make to Ravana, and then I'll come to Mariana, is that these stories are just one component of a process of trying to influence policymakers or decision makers, and that you want to think about a suite of tools for influencing. And if you follow the link that we shared earlier for the Global Fund one, you'll see there's videos, but they also had they had written articles and policy briefs and different outputs that kind of all together work to influence. Mariana.
Just to add to that about the making up a story, you can also do this, but based on real data. You want to tell a story, you have a character, and instead of picking up a real person, or you don't want to show the name, you make this history to represent that data, telling a story. and putting the challenges of most part of a population regarding a problem. For instance, what we use in this case is are personas in design, that is the character, but that character actually should represent people, you are talking about. This is important. Thank you.
Thanks, Mariana. Any last questions or inputs before I pass back over to Mike? Mike, the floor is yours.
Thank you. Thank you, Emma. Thanks for walking us through the presentation part of our plenary. That was an amazing session. I mean, who could have guessed that we would have got those stories at the end of 2 hours? So I want to say thank you to Emma for inspiring us and facilitating the end. Thank you to Emmanuel and his colleagues at Lancaster for guiding us through this process. And thank you to my colleagues at UNU-IIGH for facilitating. I also want to say thank you to our participants for bringing the enthusiasm, for bringing your ideas, and for jumping in and participating so soundly. It's what makes these workshops work. With that, I really want to just again highlight how substantial these stories turned out. We may not have made it clear, but we had 3 different perspectives going in there. So we had our older adults who were they themselves impacted by COVID-19. We had a caregiver of an older adult, and then we had a person who worked in the healthcare sector. So then we could see how these stories can be developed for each of the different personas. So before we end this session, I just want to say that we have 2 feedback forms. They're very brief. It is very helpful for us to get your feedback on this. One is already up. Please do vote and give us your feedback so we can streamline and tailor our next events. I will say that we are planning to have one more session. We have not yet nailed down the date, but since you all have been here, you will be on our mailing list, and keep your eye open for the final session in this series. With that, I just want to say thank you once again to our colleagues, our facilitators, and thank you to our participants for making this a success. Please do take a second to fill out the polls, and we will be in touch. Have a good evening and a good day.